So thank you for that. That's really, really excellent. We are going to go into question and answer. We've had a few questions that have been posted in the chat box. Please continue to do so. If you need to leave early, then here is the link to the evaluation survey that I'll encourage you and ask for. It'll take you about 2 minutes, not very long. So with that, one of the first questions we got was around cultural humility training and what it is. And I did notice that some people put links up. But did either of our speakers want to comment on, what does that really mean, cultural humility training, and why is that an important
thing? I guess I could, and then maybe Charlotte, you have some remarks as well, but for us as an organization, we thought it would be a really important skill set to start developing amongst managers because it introduces concepts like lifelong learning and self-reflective practice and challenging institutional norms and assumptions, which I think is really part of the way forward. And we kind of wanted it to frame it for managers so that they realize that building a cultural competency is not, you take a course and you're done, but that there will be an ongoing commitment to continuing to learn and to explore. And self-reflection relates to what Charlotte was saying earlier about understanding your own privilege and position and where your upbringing has brought you to in relation to the groups that you might encounter and work with. And certainly challenging institutional norms has come up in different ways, and I think over time as we develop relations and explore these issues with our community partners, we'll be able to craft and find solutions for some of the jurisdictional sand pits that Charlotte was talking about earlier.
Yeah, thanks. Charlotte?
Yeah, thanks, Mariette. And I just wanted to say that, we didn't develop our presentations together, but they couldn't have been more well balanced. I'm really happy to hear about all the amazing things that are happening in your communities. But yeah, so cultural humility is pretty, self-explanatory if you think about the term humility and what that means. And so as much as, it's important to understand, and I'm just reiterating what I said, but just to emphasize that it's super important to understand the folks that you're working with and for, but it's almost more important to begin by understanding yourself, right? And that is that most people who are racialized as white, and so I use the term racialized because race is not a real thing. It's a social construction that was created to create oppression. And so if you happen to be racialized as white, then you have privileges that are perhaps unseen in your life. The same goes for gender, the same goes for sexual orientation and social class, but racial privilege is something that most folks who are racialized as white don't think about because they don't have to think about it. And that doesn't mean that the fault lies with them, but there is a responsibility. And so cultural humility is about learning what are the privileges, the unseen privileges that I have been raised with and live with, and the systems that create and reinforce those privileges for me at the expense of people who are not racialized that way. And that obviously includes Indigenous peoples. So how do I then use my privilege to deconstruct or dismantle those very systems that privilege me and oppress others, right? And so I would say that's probably one of the cornerstones of that.
That's really excellent. Thank you very much. One of our attendants is wondering about, Mariette, you highlight the work of some artists, and she's wondering if there's a way to get links to the work of those artists that you highlighted. So if there is, for a link in the chat box, that would be great.
What was the question about how to find artists?
Yeah, so not, no, sorry, I guess it wasn't really a question. Someone's really interested in getting links to more of the work of the artists that you highlighted in the slides that you presented. So
Okay.
there's a link.
Yeah, they're all diverse artists from across our region, and if you connect with me by email, I can link you to their names and their websites.
Oh, that's great. That's very gracious. Thank you. Another question, is anyone aware of learning networks for health promoters that are trying to integrate those Indigenous ways of knowing? And there was a suggestion in the chat box around the Tamarack Institute that there's a community practice that often does an Indigenous focus through Tamarack. But I wondered if our speakers knew of any other networks that people could tap into.
For Indigenous health promoters?
Yeah. For health promoters that are trying to integrate Indigenous ways of knowing and that cultural humility into their practice.
Yeah, I'm not aware, but I think there's quite a number of resources that would be available through First Nation Health Managers Association, and also Zagedawin Information Clearinghouse in Ontario, anyway, provides a wealth of different health promotion resources that have been developed by Indigenous groups. So they're really stellar at curating and amassing and sharing quite a number of different culturally based resources as well.
And so through them, there may actually be networks and ways to link with other practitioners. Okay, no, that's great. Let's see.
I wanted Charlotte. It's Charlotte. Sorry, I just wanted to mention as well. I'm not sure. I think this is an online program that I know of. There is a cost to it, but it's a 12-week online program in cultural. I think they're calling it cultural safety, but it's administered through the Provincial Health Services Authority of BC, and it's called SANYAS. And it's a facilitated cultural safety, online cultural safety program that I think is mandatory, at least for the folks that are working in PHSA. And I know that there's lots of people from the health authorities and outside that are taking that training. And again, it's a first step, as Mariette said, in a long process, a lifelong process, really, of learning. But I've heard pretty good things about it. It's facilitated by, folks. But yeah.
Yeah, it is, and I know there's quite a number of public sector and public health agencies that are enrolling staff in that training. So it's really well done.
That's great. Thank you. Someone asked about resources and approaches around, so the question was recommended resources around sacred tobacco and organizational partnerships. Someone who travels a lot, they'd really be interested in learning how they can travel respectfully as an individual, but also as a representative of an organization. That's a really interesting question. As we go out and are engaging more directly with Indigenous people, what are some ways to do that when we're outside of our own area?
We have in the My Tobacco Resources poster series and a booklet also about sacred uses of tobacco, which I'm sure can be shared, and hopefully we'll have them as PDF versions on our website. But for the time being, if you would connect also by email, we can share those out widely.
That's great. Okay, is there any research on how to access a First Nations community pool, or on how access to a First Nations community pool is helpful for physical, mental, and emotional health with Indigenous people? So are you aware of some resources specific to?
Like, you mean a swimming pool?
Yeah, to community swimming pools in First Nations.
I'm not aware of any research about
Not
that.
aware of any on reserve, unless there's maybe Six Nations, perhaps?
Yeah.
I know that there's lots of research about the benefits of physical activity just in general, but in particularly for Indigenous youth and for Indigenous folks to, prevent, chronic disease. But and some of that research might include swimming, but I'm not familiar with any specific research that focuses on swimming as an activity in particular.
Okay, for specific to Indigenous people. Okay. That might be a real gap then. That might be a gap.
Sure.
There was a question, what are some best ways to put UNDRIP and the TRC into action and move forward as an organization? I think maybe they're looking for some really pragmatic, actionable things that can be done.
You want to start, Mariette?
Yeah, I could share that certainly I think Dr. Janet Smiley has given a little overview of the TRC calls to action in health and also practical things that a public health practitioner can do. So I think it's called 5 Tips for Public Health Practitioners or something like that. But there is a really nice, concise article that she's written about ways to do that. And certainly, starting point is to reflect on the 6 calls to action and have maybe take stock internally in your organization as to where you've come to in that in those areas. I know that the Ontario Public Health Standard also is in the Population Health Assessment Standard is describing the need for more Indigenous health data and information in some of those reports that public health does. So I think as organizations that might be a really important starting point if you do so with and for the Indigenous communities, but not on them. So I think that's a real key principle is to begin that process of discussion with your Indigenous community partners. Just for starters, that might be a good starting point.
And I think a lot of, what I hear from some of our audience is that some practitioners are struggling with where to start, especially in areas where maybe the relationships with Indigenous communities are not established or haven't even begun. And so how do you even start doing that work to address the recommendations of the TRC? And so what some Indigenous leaders have told me is that relationship building may well be the starting point.
Yeah. Well, and if you think about the TRC is truth and reconciliation. Reconciliation is about reviving or resolving relationship, right? That's when we reconcile with someone. And that's what those, if you look at those calls of action, they are, they're addressing non-Indigenous organizations, institutions, and systems. And they're asking them to make changes at that systemic level. It's great when individuals can change their practice, can become culturally humble and safe and have good relationships with individual Indigenous peoples and even communities. But when that person leaves their job, the gap may be filled by someone who isn't culturally safe. And so it's super important that systems become culturally humble and safe. Otherwise, we're not going to make changes. And so it really requires senior administration and leaders in health promotion practice and health promotion policy to take ownership of that responsibility so that the whole system becomes culturally safe and that the reconciliation happens at the systems and state level. And I say state, I mean the federal state, right, the state of Canada. And so I think if we and if you're just not just, but if you're a practitioner or a professional working, then collaborate with your colleagues and go to senior management, go to the administration and say, we really want to make sure that our system is accountable to these calls, and how can we move forward in this? And I know that First Nations Health Authority, I spoke to a whole bunch of health regulators, think it was last year, about this very thing. And so I know that the tide is starting to turn in terms of people at the senior level, but there are, in terms of at least reconciliation, it really that really needs to be our next target, along with individuals, obviously.
Okay. Charlotte, is it reasonable that that one strategy for public health organizations might be to I'm thinking about your comment around accountability, right, and building it into system level, is building targets in terms of taking action towards specific TRC recommendations, building that into operational plans, agency strategic plans, reporting on things related to community health status reports. I'm trying to think of really pragmatic ways that public health practitioners can go back and say, we need to do this, and this is why, because we said we were going to do it. Does that make sense?
Yeah. Yeah, well, in the context that I work in, which is the university, the university, the senior leadership has engaged in the process of, first of all, creating a position for a director of academic and community engagement, in developing an Indigenous plan that is separate from the strategic, education and research plan for the university, and getting the deans on board. And so it's a matter of the people at the highest levels who have the authority to make those policy decisions, right? It's sort of like, we're not allowed to bully people in the context of our work. We're held accountable for that. And so if people are, trained, and then the expectation is that they will be culturally safe, there's motivation there.
Yeah, yeah. Oh, really excellent. Thank you. We have another question. Well, a few people looking for some links to resources, and I think they were ones that Mariette mentioned. Looking for links to the My Tobacco resources, favorite use of tobacco. I did see a link go up in the chat box, but I'm not sure if that was the same one. Also, someone made a comment that using the term support versus interventions is new. And so is there any background or context on this? And also knowing if we suggest where we can review criteria to co-develop those kinds of things with partners, or co-develop criteria.
Well, I can speak to the first question, and maybe Mariette can take the second one. That's a term that I've been using. I'm not aware of any published literature. I just know that the term intervention is often seen as pejorative in our communities, the same way that consultation is. And so I try to use language that speaks to the value behind the term, and sets us in a different direction. But that's just my own,
Yeah, I've heard that too, and I've heard that similarly, the term client is there's a lot of power and positioning involved in that, referring to communities as or individuals as clients versus as partners or having relationships. So, talking to the community about what resonates with them.
Okay. Someone was asking about co-developing as a process or an approach. It really comes from in a lot of community-based research, they'll use an approach that's premised on participatory action principles, and it really means that instead of an outside agency crafting the study design, you would instead work with the community of interest and develop that together. And also, even to the point of developing what would the research question be, what's meaningful and important to that community, just like Charlotte was describing earlier. So that process of meaningful engagement really tries to embed the notion of mutual benefits and reciprocity, and understanding that there are different worldviews at play, and respecting community self-determined aspirations. So it's really it's a framework for helping to move relations closer and to build trust and respect where a community is at and what's important to them. And I think that really then helps to develop how you strategize together, and then how you implement things together, and to how you evaluate, because our definition of success may not be the same as the community's definition of success. And I would just relay an example that we're doing right now with our research project. We have, as I mentioned, talking together to improve health. We have an Indigenous circle that we look to for advice, and they help to interpret findings and validate and affirm our approach. So they're like an extra set of eyes on the project, so a two-eyed seeing approach. And I think that's really an important principle around which to build any collaborative relationship or project. I'm not sure if that answered the question, but I think the meaningful part entails you asking the community what's meaningful and important to them.
Exactly. What about being inclusive of a variety of evidence in project description? You know, a lot of times in public health, we are still so reliant on formal published sources of evidence. So how can we integrate and be inclusive of a variety of evidence in our project descriptions, and how do we take the leadership in the community and what evidence is useful to them?
Mm-hmm. Yeah, evidence cannot not having the same weight, and I think, you know, evidence becomes a question of whose evidence holds sway, and so you really have to be mindful that the body of knowledge in communities might be sacred teachings, and that's not written up in any journals anywhere, you know, or the body of knowledge in a community might be from the way that they do things there, like in everyday reality and context. So the evidence that we tend to rely on sometimes is numbers and journals and, you know, esteemed authors is not the same as what the community might esteem or privilege as evidence. And that's where I get back to that notion of community voices being really important. When you go to the community, work with them, you know, ask them those questions, work with their elders, you know, let it be driven by community, and let go of the reins of the need for the numbers and the evidence as strictly as we've sort of come to rely on.
Yeah, and I went to a session at CCDH last year where they talked about how, you know, a lot of the published evidence that we do typically, we as practitioners do typically rely on, is, you know, is coming from a place where Indigenous communities are not well represented among the researchers, among, you know, the people that are generating that evidence, and it's that it's really a reflection of some of the colonial structures that are in place, and so it's not, it's just not reflective of the reality of it, and may not apply.
And it may not exist. It not necessarily have a lot of data or numbers and so on.
Exactly.
They're used to it.
Yeah, exactly. That is it, I think, for our formal questions. I'm going to start closing out, but I'll ask if anyone has final questions they want in a couple of minutes. Mariette and Charlotte, did you want to close with any final thoughts?
No, I'm just grateful for everyone's kind attention. It was great talking to you all. I see folks are starting to sign off, but yeah, thanks. Great time.
And I'm appreciative of the opportunity to share the kind of work that we're doing in public health Sudbury districts. And I would emphasize again that every one of us is on a learning journey. So wherever we can help, we're happy to do so. And I hope one day there will be a community of practice of sorts in Ontario, at least, where public health can join together as agencies to learn more together about how to do this in a meaningful and mutually beneficial way. So thank you for the opportunity at NCCDH and Health Promotion Canada.
Great. And I just, like I said, I feel really privileged that we were able to bring this together to talk about this. I will ask that people fill out the evaluation survey. It will just take a couple of minutes, and we really want to hear from you, especially how we can do further work in this area, what other areas of interest or what other topics of interest within this area you have